As for this video presentation, I have chosen to speak about the epidemic of COVID-19. Without further ado, I'll start with informing you about what is COVID-19. So coronavirus disease 2019 or COVID-19 is defined as illness caused by novel coronavirus called severe acute respiratory syndrome coronavirus 2, which was first identified amid an outbreak of respiratory illness cases in Wuhan City, Hubei Province, China. It was initially reported to the World Health Organization (WHO) on December 31, 2019. On January 30, 2020, the WHO declared the COVID-19 outbreak a global health emergency. On March 11, 2020, the WHO declared COVID-19 a global pandemic, its first such designation since declaring H1N1 influenza a pandemic in 2009. Illness caused by SARS-CoV-2 was termed COVID-19 by the WHO, the acronym derived from Coronavirus Disease 2019. The name was chosen to avoid stigmatizing the virus origins in terms of populations, geography, or animal associations. On February 11, 2020, the Coronavirus Study Group of the International Committee on Taxonomy of Viruses issued a statement announcing an official designation for the novel virus, Severe Acute Respiratory Syndrome Coronavirus 2. The Centers for Disease Control and Prevention (CDC) has estimated that SARS-CoV-2 entered the United States in late January or early February 2020, establishing low-level community spread before being noticed. Since that time, the United States has experienced widespread infections, with over 32.6 million reported cases and over 581,000 deaths reported as of May 14, 2021. On April 3, 2020, the CDC issued a recommendation that the general public, even those without symptoms, should begin wearing face coverings in public settings where social distancing measures are difficult to maintain to abate the spread of COVID-19. The CDC had postulated that this situation could result in large number of patients requiring medical care, concurrently resulting in overloaded public health and healthcare systems, and potentially elevated rates of hospitalizations and death. The CDC advised that the non-pharmaceutical interventions, NPIs, are the most important response strategy for delaying viral spread and reducing disease impact. Unfortunately, these concerns have been proven accurate. The feasibility and implication separations and mitigation strategies have been rigorously analyzed and are being encouraged or enforced by many governments to slow or halt viral transmission. Population-wide social distancing plus other interventions such as home self-isolation, school and business closures are strongly advised. These policies may be required for long periods to avoid rebound viral transmission. As the United States is experiencing another surge of COVID-19 infections, the CDC has intensified their recommendations for transmission mitigation. They have recommended universal face mask use, physical distancing, avoiding non-essential indoor spaces, postponing travel, enhanced ventilation, and hand hygiene. According to the CDC, individuals at high risk for infection include persons in areas with ongoing local transmissions, healthcare workers caring for COVID-19 patients, and close contacts or infected persons and travelers returning from location where local spread has been reported. So that was a little bit of introduction of what COVID-19 is about. So my personal advice is always take care of yourself and stay safe wherever you at. We should all work together to fight this virus and to flatten the curve. No one can do this alone. We should all work together. As Tan Sri Dr. Noor Hisham have said, we are not losing. It's just that we are not yet winning. So let's fight in this battle till the end. Stay safe and thank you.